Hello and welcome to our COVID-19 update where we'll be speaking to the Minister of Health, the Honorable Dr. Frank Anthony. Hello Minister, thank you for having us again today.
Well, thank you very much for having me on the program.
Okay Minister, let's start today with an update on how many persons have been vaccinated so far.
Well, thank you very much for the question. As of yesterday, we had 205,944 persons who have been vaccinated with the first dose of their vaccine. That would represent about 42.3% of our adult population, and those who have been fully immunized as of yesterday would be about 72,045, which represents approximately 14.8% of our population. We have differences across the region, and in Region 1, for example, they have been able to accomplish close to 46.6% of their population. Region 2, they have been able to immunize approximately 40.3% of their population, and this is first dose. Region 3, 42.6%. Region 4, 43.2%. Region 5, 46.5%. Region 6, 50.2%. Region 7, 42.3%. Region 8, 27.5%. Region 9, 40.5%. And Region 10 at 12.4%. So the two regions that are outliers are already Region 10 at 12.4% and Region 8 at 27.5%. So we have to do quite a lot of work in these two regions. One of the challenges right now with Region 8 is the flooding that we have there. In Region 10, we've known of the persistent problem that we have there with vaccine hesitancy. So we have to continue to work. But I think Region 6 would have met a milestone here, having been able to achieve at least 50.2% of their population. We still have a long way to go, but it's good to at least mark these significant milestones.
Minister, I know you would have mentioned that the flooding is contributing to Region 8's percentage being quite low, but is the layout of the region also a contributing factor?
The geographic layout is also challenging because we have, as you know, it's quite mountainous. So in normal times it's difficult to reach some of the communities. And this now has been compounded with the rains, so it's quite a challenge.
Okay, Minister. Now, let's talk a little bit about Region 9. We've seen a jump in COVID-19 cases recording there. Could you highlight some of the hotspot areas in the region and provide an update on how we are monitoring the situation?
Well, again, in Region 9, there's a mixed set of cases in a sense. There are some communities where we have identified cases earlier, so for example in Guns, and those cases have dropped over the last week or so. We now see spikes in the Rupununi River, so at Apateri there are a number of cases there, and we have seen an increase in cases in Rewa. So the increase in numbers of cases that we are now seeing in the region is primarily because of these two communities. So we have teams that went in, they have done testing, monitoring, and for those persons who are negative, we are able to offer them the vaccine. So we have been doing vaccination in those areas as well.
Okay, Minister, thank you. Thank you very much for that. Now, it's been a while since we've spoken about COVID-19 and travels. To date, how many imported cases have we recorded since the reopening of our two major airports last year?
It remained basically the same. We are about 52 persons who we would have detected when they came here. And that's because they were required to do a second PCR. And when we did the PCR, we identified them as being positive. So this has been more or less constant for the last couple of weeks, but we continue to be vigilant and monitor people at the airports.
Okay. Those who are fully vaccinated have expressed some amount of relief that they're now safe to travel internationally. Would you say, Minister, that traveling is still risky and persons, though vaccinated, should avoid non-essential travel?
Vaccination would help to reduce infections, and as we get more and more people vaccinated, travel would become safe again. But you don't know who would be sitting next to you. You don't know how many of those persons boarding a plane would have been vaccinated, because as it is now, it's not a requirement to have a vaccine passport. There's a lot of discussion pertaining to that, and in some parts of the world they have implemented it. In the Americas, we haven't been doing that as yet, although there have been a lot of discussions on that. So if we move towards a vaccine passport, then you can be assured of the people in the plane. But as of now, because there isn't a requirement, you still have to take all the precautions, which would include wearing a mask during the flight, and of course, if it's possible, within the plane itself, to keep some distance from the other person.
Okay, and are there any plans to lift the travel requirements, the mandatory PCR test for persons entering Guyana?
No.
For vaccine? No?
No, because again, that's our only way of monitoring who is coming in and to make sure that they're negative. In the world today, there are just a little bit more than 1 billion persons who would have been vaccinated. So there's lots of people who are unvaccinated, and lifting those requirements would basically not allow us to know whether or not people are coming in here and they're positive. So we really need to keep those requirements in place. Sometime in the future, perhaps we'll be able to do that, but as of now, those requirements would stay.
Okay. Minister, now yesterday Guyana would have received 2 ventilators thanks to the Mexican government. Could you state the cost of these and say where they will be placed?
I don't have an idea how much it costs, but prior to this particular donations, the Mexicans would have given us 2 other ventilators. I think they're of similar manufacture, similar made. And they have worked pretty well because we're using those 2. This additional 2, we will be placing them at the Ocean View facility, and so it would complement the existing 25 or so ventilators that we have there.
Okay, Minister, thank you. Now, before we go, I have a question from the nightly news. The Indian variant of COVID-19 virus has been detected in neighboring Venezuela. They're asking if you can say if there are any plans to improve border security with the affected country to limit chances of the variant being imported into Guyana.
Well, the joint services have been working to improve border security. As you know, we have quite a long land border with various countries, Brazil, Venezuela, and they have been really working hard to reduce traffic between countries. Unfortunately, there are going to be people who are going to slip in and out, but with added surveillance, we are hoping to reduce that. By doing so, we'll reduce maybe people coming into the country with variants. We also have to be mindful that variants become dominant over a period of time, and so after the initial outbreak in Wuhan, that original virus was superseded by a variant called D614, and then after that, we saw in late December last year, you had a variant that was discovered in the UK that spread and became pretty much dominant in many parts of the world. So these variants, because of their increased transmissibility and so on, would be able to supersede the existing one that is circulating. So we have to be constantly mindful of that, and we're, working to ensure that we understand what is going on here with the dynamics.
Okay, thank you for that, Minister, and thank you for your time today. This has been our COVID-19 update. For more information, visit our website, dpi.gov.gy, or our social media platforms.